Hi, everybody. Welcome to another Chats with Chaudhry. I hope you're safe and well. Today, I'm delighted to be joined by not one, but two guests from Terrapin. And I'm delighted to be joined by Jessica Robinson, who is the Project Director for Advanced Therapies Congress, which is coming up next week, and Ila Dickinson, who is a Conference Manager for Advanced Therapies, which is happening, not next week, the week after, I should say. And we are going to be doing a preview for Advanced Therapies Congress, which is going to be held at the London XL on March the 14th to the 15th, and find out what delegates and visitors and exhibitors can expect if they're attending the show. So, first of all, Jess, Ila, it's lovely to see you both. How are you?
Hi, yeah, good, thanks. Yeah, just waiting for the event to happen. Very excited now.
Good, excellent. And you, Ila?
Yeah, the same really. Just looking forward to it happening now. Ready for it.
Excellent. Right. Okay. Now, first question with both of you is, for those people who are not familiar with Advanced Therapy Congress, can you give me a bit of a history on the event, why you launched it in the first place, what it covers, and who it targets?
Okay, so the Advanced Therapies Congress was started way back in 2005, so 18 years ago, and it was originally a small academic stem cell meeting when the stem cell industry was in its infancy, and it was 200 people, and it was for sort of researchers in the cell therapy space in order to push forward innovation and to try and get these things into the clinic. I mean, 18 years later, here we are, and the event is still looking to push forward these therapies into patients and try and get patients access to them. But we've come really far. So the industry has blossomed and diverged into cell therapy, gene therapy, immunotherapy, regenerative medicine, and all those things that encompass advanced therapies and ATMPs. So we now look at the entire developmental pipeline from early stage research to manufacturing to clinical trials, and now to pricing and market access. And supply chain and logistical challenges, infrastructure in healthcare systems, and yeah, it's come such a long way. So you asked me about 4 questions. I think I answered half of them. What were the second?
Well, you did answer it. So, so my other part of that was that because it has expanded so much based on what you just said, who are the people that you're targeting? You said it started as an academic, more an academic event. So who are the sort of people you're targeting now for the event?
Yeah, so it's the entire value chain of the advanced therapies industry, from people working very early stage research to all the way through to big pharma companies, people in pricing and market access. So people at every stage of development, and companies and researchers at every level, from very early stages to the late stages, and also people working in healthcare, HTAs, regulators, investors, startups. I mean, the main kind of percentage of the audience is still kind of biotech and pharma companies, but then we still have academics, researchers, HTAs, investors, lots of startup companies, a
Sure.
whole
And forgive my ignorance, but what's an HTA?
A health technology association, I believe, is the acronym. Yeah.
Okay, cool. I wasn't sure. Ila, do you want to add anything?
I think you covered everything, to be honest. Yeah, we have quite a lot of startups coming as well, which is an exciting part of the event. Yeah.
Fantastic. All right. Now, as you said, you're one of, you've been going for a long time now, 18 years. Now, I know, as you all know, because I see you at a lot of these other events, there are a lot of events out there now which are covering ATP MPs in some shape or form. Obviously, the industry events, but association events, I should say, but there are also lots of other commercial events. So what makes ATC unique compared to those many other events, many which have launched over the last 2-3 years, in fact? What makes it unique?
Yeah, there are a lot of other events out there now, because of the industry and where it's at. There's a lot of investment and money happening in the space, and a lot of conferences see that. Well, what sort of sets us apart is we're firstly the largest commercially focused ATMP event in Europe. So we're really looking at pushing through to commercial kind of level and to patients, and we're sort of focusing on the commercial stages of development. Also, we have a big focus on bringing in the earlier companies, like those startups that Ila mentioned. One of our USPs is that we get 100 early stage startup companies at the event each year, which no one else does in the space. And yeah, it's the entire kind of cross section of the developmental pipeline under one roof as well. So not just the C-level people, not just the biotechs, but kind of everyone under one roof.
Right. Anything to add?
I think I would just add that we have quite a lot of networking, good networking, like well-facilitated networking. The networking app that we use is open now. It's been open for about a month for exhibitors and sponsors. So people have been online and booking meetings for a good few weeks now.
Right, great. Well, we'll talk a bit more about networking as well. Now, in terms of the tracks, obviously, as you said, you cover the whole value chain. So without going in depth onto each specific track, historically, what tracks do you have and what new tracks have you added for this year, if any?
Yeah, we have quite a lot. As I said, we cover quite a lot at the event. So we have historically sort of 7 core tracks. One's on the particular therapy area, so cell therapy, gene modified cell therapy now, and then we also look at different stages of development as well, so manufacturing viral vectors, manufacturing cell therapy, pricing and market access, a regulatory track. Those are our kind of core topics, and then newer topic tracks that we have are supply chain and logistics, clinical trials, where we look at the kind of clinical operations and running of the trials. And then we also have a whole track focusing on the startups this year as well. So our startups will be pitching and we'll be having some panels of investors as well on that track.
Okay. And in terms of speakers, and I know you have keynote speaker to launch the event on day one, and I'm not sure if you have keynotes. I'm sure you have one every day. So who are the sort of keynote speakers that you've got lined up for this year's event?
Well, we have a lot of them this year. We have Peter Marks from the FDA who'll be speaking.
Is that virtually, or will he finally be there in person?
He's always virtual. He's the one virtual speaker, you know. He always wakes up in the middle of the night. It's amazing how he does it. But yeah, he'll be kind of live on a few panels, giving us some updates. Bruce Levine will be coming in person from the States, which will be great to kind of have him speaking and on some panels as well. Federico Mingosi, who's the CSO of Spark, he'll be giving us some updates. We've got Ezra Ridher, who's the CMO of AvroBio, Angela Justice from TCR2, Jennifer Harbottle from AstraZeneca, Kathy Ivey from Tenaya Therapeutics, Yap Bolens from Memorial Sloan Kettering, Miguel Forte, who's the president-elect at ISCT, and Elsa Abranches, who is at AstraZeneca, and many, many more. We've got 250 speakers, is it, Ila, this year?
Yeah.
Right, fantastic. All right, now, Ila, you touched on networking. So apart from, obviously, the sessions that you've got in place and the exhibition floor, what else can delegates expect to do or engage with at the event?
Yeah, so we have quite a lot going on. Obviously, the startup zone is one of the busiest areas of the expo. It was last year as well. So we have a dedicated networking break, which is a Meet the Startup session for everyone to head to the startup zone to meet the 100 startups that will be there. We also have an interactive poster session. So I think we have about 75 posters this year.
Right.
So we have a networking break dedicated to the poster session for everyone to meet the people who are presenting posters at the event and talk through those with them. We also have a networking drinks reception on the evening of day one in Canary Wharf. I can't remember the name of the venue.
Lovely venue.
Right, excellent. And you said people can connect up on the app as well prior to the event and during the event, correct?
Yes.
Right, fantastic. So, last words. If anyone is undecided as yet to attend and sign up to the event, Jess, I'm sure you'll take this. Why should people sign up to Advanced Therapy Congress, which starts on the 14th?
Well, I mean, it's going to be a great event. I mean, I would say that, but we've got, 50% more attendees than we did last year. Like, events are back. I think people have really missed meeting an international crowd, and still last year we were quite restricted. So it's already going to be the biggest yet. We've got even more features, like Ila said, huge number of posters to see, startups, updates from these innovative companies. Great keynotes, great networking, roundtable discussions. Everyone's going to be there, so bring your team, basically.
All right. There you go then. So if you have not signed up yet for Advanced Therapy Congress and you work within the ATMP arena across the whole of the value chain, right from the very beginning to drug delivery, then check out the link above the video and see the agenda, and hopefully you'll say, wow, I should be there, and you can sign up. Still, right up to, I would think, most really the Monday before the event starts. Is it Tuesday? I can't remember. And sign up and attend. So, ladies, it's lovely to see you both. I look forward to seeing you in person, not next week, but the week after. And I hope you have a as stress-free build-up as is possible leading up to the event. It's never going to be completely stress-free, I know, but I hope it all goes smoothly for you, and I hope you have a great event. I look forward to seeing you there in person. So Jess, Ila, thank you very much for your time.
Thanks, Rizwan.
Thank you.
And thank you viewers for watching. So as I said, if you have not signed up yet and you're involved in ATMPs in any shape or form, check out the link, and hopefully I'll see you there in person as well in a couple of weeks. So until next time, as always, stay well and stay safe. Bye-bye.